when you talk about intimacy and sex, people close their ears and they just walk off and they don't want to talk in a public platform, basically. And today we are going to break that taboo.
Hi, everyone who's made it today. I'm Shivanya Yogmaya, relationship and intimacy coach for singles and for couples. And I've been doing this for the last 10 years over, dealing with all kinds of aspects that affects our emotional, physical well-being.
I'm Dr. Sagar and I work for DrSafe and Hyderabad branch. I'm the senior consultant STI physician. Basically, my job is, what to say, looking at the opposite part of the sex where people are more scared of. And Shivanya deals with the fun part of it.
So the first one is importance of intimacy for a good sexual health.
Okay, so as we understand, intimacy. The word intimacy is not only limited to the word sexual intimacy. There's something called emotional intimacy as well. So without the emotional intimacy, sexual intimacy cannot be enhanced or, explored. Because when we say the word intimacy, it means I see into you. I trust you with myself, and especially the body, right? So it is all about being able to help each other, the partners, whether it's a man or a woman, learning to communicate their needs, wants, and desires, whether it's about the sexual act or about your fears and pain and failures. So once you build that kind of bond, sexual intimacy becomes even easier. To tell a few things, let's say for a woman, being appreciated, being loved, being cherished, being complimented, and even her fears being heard, her needs being heard, then a woman is surrendered to you. She's open to trusting herself. Otherwise, when the emotional body is not secured, not relaxed, her body shuts down. And as for men are majorly visuals, okay? So for men, there are also needs for emotion, no doubt about it. So talking about their emotional needs, if women can take care of, showing their pride in the man, showing respect, acknowledgement, feeling of support as well, like standing up for him in his moments of trials and challenges, can make him feel a masculine person. And also voicing, flirting with your man, being able to tease him also. Why should it be always the man leading on? Maybe sometimes even they want you to lead this act, to, flirt with them. And the flirting is much before. So once your emotional needs are met, your intimacy is, bonded, then the sexual explosion can happen. So even a man can feel sexually rejected. A man can also feel sexually wounded. A man can also feel admired and desired. So the emotional intimacy leading to sexual intimacy is much easier. Because in the beginning, the spark can be there. But then what after that? You need to build it and nurture it and keep it alive as well.
That's nice. That's a very interesting observation.
Right. Dr. Sagar, what about the health part? Like, how do you want to talk on?
So talking about intimacy, so I just want to put in a very small medical definition of health here. Health is a complete state of complete physical, mental, and even it covers many different dimensions of mental component also. So whenever we are speaking about intimacy here, when a person's mental component part of his health is affected, the intimacy will always be affected. So, considering the importance of mental components for a better holistic or better overall well-being of a person is very, very important that many of the couples, young couples, older couples, whatever might be the age or whatever might be they in their particular point in their relationship, these days we are finding a lot of them being affected. It can be their own stressful lifestyle or it can be their own fears, insecurities or whatever, but at the end of the day, the act of sexual activity has been going towards a little mechanical and more into what to say. Even the fear of STDs and different partners, all these things are also creeping in. So at the end of the day, the intimacy part of sex is being missed by many couples these days. There are many times when couples come to us for part of couples counseling, where we find that very small adjustments in their regular lifestyle can bring about a lot of change in whatever the relationship they're having. And at the end of the day, happy people are healthy people. This is what as far as medicine goes. So yes, intimacy is a very, very important part, but not much care is being taken regarding the intimacy part of health. This is
I
something
also
which needs a
like,
consideration.
yeah, I like to also add from the medical point or the health point, stress is one of the biggest contributing issue that doesn't allow people to enjoy sex. It's like a quick fix. Let's do it and get over with it. Because of the corporate lifestyle, because of the different shifts, we don't really make time for it. Secondly, uh, couples have actually voiced it that he smells or the woman smells. I don't like it. It's not clean or when she's not smelling good. So hygiene is another thing that can put off and turn off the need and desires for sexual intimacy. And mental emotional state, yes, as you rightly pointed out, insecurity, especially when men are going through their challenges, business setbacks, so career downfalls, it affects their mental health. And so it affects their sexual behavior or sexual interaction with the women. So that time we need to have a very open dialogue in a relaxed atmosphere, trust, encouraging dialogue so that they feel motivated in times of trials. So yes, the medical health as well as emotional health and mental health is very, very important to keep it alive.
This is what even I am trying to stress upon because if we are just concentrating on treating the disease component and we are forgetting about the emotional component where people have to be like see, intimacy is something which exists between couples, or it's a very broad term to describe right now. But at the end of the day, my point is that even if we are just treating the disease by giving some medication, or if we are just doing like that, I don't think it is going to provide enough or complete all-round happiness, or even the definition of my health will also not be satisfied.
So coming to the second one, I think a major population is hit by these days. We can see, I'm sure Dr. Sagar will be knowing it, that today's population is hit by erectile dysfunction and premature ejaculation. We all know that. So what are your views on this, Dr. Sagar?
So I'll try to just for anyone who doesn't understand what erectile dysfunction, premature ejaculation is, I'll try to put it in a very simple language. Difficulty in either getting erection or maintaining an erection. Okay, this is erectile dysfunction, and coming to premature ejaculation is it is nothing but see every person has his own individual timing in which he can ejaculate once the act of sex has been started. So if he is ejaculating very fast, maybe under 1 minute or 2 minute, or if he is ejaculating in the arousal phase itself, and arousal means there will be different phases in a sexual activity. But to be putting it in short, whenever a person gets sexually stimulated or aroused by looking or feeling or listening to his partner, he gets aroused. That is the arousal phase. In the arousal phase itself, even without any stimulation, many men they tend to ejaculate. So this is premature ejaculation. I think Shivanya can shed more light based on her experience and practice in this particular domain.
Yeah,
I
over
so
to
agree with
Shivanya.
you, Dr. Sandra, that most of the clients that I've also dealt with, those who were suffering from erectile dysfunction or pre-ejaculation, came to me saying that the doctor advised them for a counselor as well. So yes, there is a psychological aspect to this issue And it can be treated both with medical assistance and psychological therapy, because most of the time it is our brain telling us something, or over exhaustion, or over judging our own self performance, especially. For men, it is more of a performance anxiety. And probably sometime when I looked into their history or their background, I asked them, like, for how long have you been feeling this way? Or is it a new occurrence, or it's been all along? Was it your first time, or the, latest, like at the age of 40, as you mentioned, it has happened to them in the middle of nowhere, or sometimes at a very early age, because something happened. Somebody teased them about this experience so that they can't perform, or somebody made them feel that they're not good enough, or they were so not trained how to handle their physiological and psychological wiring for a sexual act. And very truly said is also the porn is affecting their sexual intimacy. In fact, one of the couple got divorced because the husband was hooked to the porn. He could not perform with her without seeing the porn. So she felt rejected emotionally. She felt like, well, what the fuck? Why am I not? Why are you watching that when I'm? And she was very turned off by that. So yes, there are different psychological factors. Beside that, there are also stress levels, which creates the pre-ejaculation, especially certain habits like alcohol, or certain medicinal reaction, or their stress lives taking on. So it contributes to pre-ejaculation as well. As far as erectile dysfunction is concerned, it may be something that has to be even dealt medically as much as psychologically. But when I have dealt with my clients, they have been more about pre-ejaculation. So now in these conditions, I also request women out there, if your partner is suffering from any of these two, please be empathetic. Don't make them feel that they're not man enough, or they can't perform, or you don't satisfy me. Use certain ways to elongate it, change the position, change the room. Sometimes switch off light, or just do the blindfold act, or just to make it last longer. And also to make your man feel calm. The way you treat him, the way you make him feel about his body can also make him relaxed. And wouldn't have this performance. Of course, there are some pelvic exercises and certain other exercises, pinch technique, which I counsel on these techniques also for men. And for women, they have to learn how to train the act itself, so that it can be a better foreplay, leading to more satisfaction. And sometimes you can use sex toys as well to help each other. So yeah, this is what I have to say about it. There is a way out, so don't give up. Don't feel that you can't be satisfying a woman, or you can't do that. Because some of the men have started avoiding their women in the sex time. They would just get too busy, or just avoid talking about it. It's okay to talk about it. It's okay to find solution rather than shutting it off, or evading the topic. Thank you so much for asking this.
Yeah,
Yeah.
just like
So
Shivanya mentioned, there is nothing to be afraid, or it's not untreatable or anything. At the end of the day, everything, almost all these conditions are completely treatable. But people are in a dilemma or in a confusion that once something like this has hit, suddenly
yeah.
it becomes untreatable in their minds.
So coming to the third one, like what is the role of self-image in a good sex life? Shivanya, you can go with it.
All right. So coming to the body self-image, that's the right word I would like to say, because your image about what you feel about your body, shape, color, texture, and as we mostly women have had major issues with their um, breast size, or hips, or body contours. Sometimes their parents would have actually made them feel that you're not good, who will marry you. And this gets into, and it has happened to my clients. I clearly remember that it actually, the sexual intimacy was affected because of what happened in the childhood. And she was not able to feel relaxed to open up herself or to, and she always wanted lights off because she was very judgmental about her body. But who taught her? Who ingrained it? So through therapies and counseling, she was able to undo that and learn to love her body. Same with men. They have this about this size of the penis, which comes across very often to me. And they don't feel good about themselves. Some of them, um, I remember a man of the age of 46 not having consummated because his sex life, he remained, virgin, did not even marry, because when he was young, he was changing rooms. Changing rooms were there for boys in the after basketball court. He was living abroad at the time, and somebody made him feel no girl is going to really like you. And look at that, you will never be able to satisfy any woman. Oh, look, and they all laughed at him. Gang laughed over that. So that also left him feeling wounded somewhere as a man, though he was a wonderful person as a social being or something else. Everything else was normal. But this part, intimacy, sex, women, was a big no-no. So you couldn't even make out. But then he created such a barrier, which as long as the age of 46, of course. I had to help him through counseling and healing and therapies to let go of that shame or that feeling of not good enough about the body and size. And then this happens, even the partner telling a woman that, you are not beautiful, you're not attractive, or they comparing her to other person, or even women doing this insensitively, making their husband feel that वो बात नहीं है types, or something, you don't satisfy me, I don't like the way you look, or so these are very sensitive things we should not in intimate relationship speak in such a way that it creates a barrier. And your own self body image is also, it's not about what others also say. Sometimes it's what you say to yourself. What do you feel about your body? That is also equally important. So if your partner has said something, your parents have said something, that's not the only way to measure and feel this way. You can develop a healthy self-image with your own body. Whatever shape, whatever color, whatever texture. Take care of your body if you have to. But don't judge so harshly that you do not remain natural and, perform or be allowing yourself to explore and, have a better intimate life. So yes, a lot of self-judgment or judgment by others can create sexual hazards or intimacy hazards.
Moving on to
Okay.
Dr. Sagar.
So just since Shivanya has put it so beautifully, but I'll just tell you a little small excerpt. I don't want to take any like references of people, but I'll tell you a common phenomenon that I'm observing these days. People, youngsters, even not just youngsters, even 40 to 50-year-old people, because of the what we can say, the advent of cell phone or mobile phone, the use of technology, the world has got into our hands. Because we cannot, in olden days, we can only attribute any kind of these negative feelings towards peer pressure. But these days, the peer pressure is not coming from outside. Most of the times, it is coming from inside because of the technology. Like youngsters or the what without the age, there is no age differentiation. We find people comparing themselves by looking at bizarre things on the internet. Like they are reaching a mindset where only movie stars and heroines who maintain their body in a particular shape are supposed to have a good particular quality of life, and they are not even comfortable with what to say, to accept whatever is there in them, and they are not able to accept the reality of whatever is there in them is at the end of the day that is enough. The situations have changed so far because of the advent of technology. There can be multiples for this, but whatever it is, there is a lot of self damage that is being done by people by themselves on the basis of comparison with many things. At the end of the day, it's your job to just wait instead of deciding something bad about you or bad about the society, and wait for the particular person to come walk into your life. At the end of the day, everyone gets a partner here.
Coming to the last question of the live session, what do you all think, your views and opinions about sex addiction and masturbation? Shivanya.
Sex what?
Sex
Sex
addiction.
addiction.
Yeah.
And masturbation addiction. Okay. So usually this is found in my client cases. It was usually found because they had no purpose in life, or they were going through certain crisis, and this was a distraction for them. After all, sex and masturbation is nothing but pleasure. It just makes you feel momentarily distracted from the reality of life. And also it becomes a behavior because they were not able to feel good in some relationship, so they went into series of sexual behaviors with sexual partners. Sometimes it is like, okay, I am a man. I want to prove it to myself because I was rejected once, so I'm going to now reject many more girls by having sexual behavior with different partners every weekend. And this leads to then unknowingly into sexual addiction. Now your body is cells actually demand it. Even if you're at office, like one of my clients, rather not one, few of my clients have even admitted and confessed that when they are at their office also, they feel the desire and erection for every woman out there. Now, why does that happen? Because your body and your mind has programmed for sexual urges way too much than actually required in every scenario. Now, this is the reason why they get distracted, and this is the reason why their goals are also not met. They have energy drainage, and by having two partners in sexual addiction behavior, you actually dent your aura. And I've found it in all the cases to beware you that when you have sex with every Tom, Dick, and Harry, or every Tina, Mina, Dina, and you keep changing partners too frequently, thinking that this is the chill thing, this is the way to live life to the highest, or this is way of living life queen side or king side. I think you're bluffing yourself. You're actually misleading yourself by certain wrong beliefs. There's so much more to live life in different ways. So, and this also comes from a low self-esteem. This is why you're going on proving yourself. This is why you're not dealing with the real things and going into that. Then I've also found people who have sexual addiction is also because their body energy or libido is very high as compared to their partners. The partner was not able to, satisfy them or give it as often as they want. So they move into different partners, thinking that okay, once or twice I'll do it, or once in a blue moon I'll cheat on my partner. But later it becomes like a lion who learns to eat meat for the first time. Now he has become addicted to having more meat, but only to know that later on it creates an emotional conflict, it creates a guilt factor, it creates a distraction from your goals, and also it leads to your sexual health issues, medical issues. Okay? So be aware of what you're doing to yourself and your body. And as far as masturbation addiction is concerned, no, there are normal masturbating every day is not a problem. Masturbating twice or thrice is not a problem. But when it becomes your only focus, more often out of distraction, out of ill beliefs or behaviors, become an addiction of a different kind, which again leads to wrong sexual behavior in the future with your partner. So you'll find masturbation only the way to ejaculate. You won't enjoy with a partner. That also happens to some of my clients' cases because they were now sensitized by the real, natural, organic sexual act and behavior. So be aware of what you're doing to yourself. There's no need for guilt. There's no need for hiding and evading and escaping your life situation. Learn to deal it through medical assistance and therapists. seek out their sex therapists as well, not just intimacy coaches like me. There are other therapists and people who can guide you to come out of this vicious cycle. That's what I have to say. It affects your mind, body, and your relationship.
User is Niyamita 319. That's what happened to me. I think, are you there, Niyamita? If you're there, you can just, if you are speaking about masturbation addiction or anything, trust me, since you are able to tell this particular thing that that's what happened with me, it itself is a indication of self-realization, and self-realization is the first step of healing, Niyamita.
She meant to say that, what if my spouse
If my
knows that
partner
I'm
finds
not a
out.
virgin after wedding? That's what she meant to
Not
say.
Yes.
okay, okay. Sorry for my ignorant this thing. See, at the end of the Niyamita, we have to understand even your partner, the present generation. See, virginity is not a what to say is it should never be a criteria for identifying what a person is. I think the society is on par with it, and the people are on par with it. Your question is that what if he knows? At the end of the day, no one is here. To put it in short, okay? Because each I'm telling about not just the physical form, mentally. I'm telling speaking about mentally. Have you seen any guy who has never looked at a woman or thought about a woman? If there is any person who is existing like that, you can call him according to the definition of the we that you put in. But at the end of the day, it's how you both communicate to each other, how you respond to each other's needs, how you are with each other whenever there is a moment of crisis or whenever there is a moment of happiness. That matters for a happy life, not a particular what to say the we thing that you put in there. Okay, there is
Good.
absolutely no need. I understood,
I think the
Shivanya. I
female
just do not
part of
want to get
this,
that.
right, the female population is actually, they are scared of the same thing. And that's
Yes.
why, after wedding or before wedding, they're always, they have to make themselves so
Tense
strong
about it.
about this part that,
So I can give you a small representation from the male population. I don't think not many people, not many men these days are thinking about virginity and stuff. Since she has put it like that, I am just refraining to use that word. But now I think I should be using it because at the end of the day, why is it a taboo, man? Why should it be a taboo? Why should sex be a taboo at the end of the day? Everyone is doing it. It has been there since like we are all born because of the same thing. Yeah, we have to accept that fact. Okay,
right,
and virginity is not a physical finding that has to be given much value. And I can take the word of I can represent the entire male community also of the present time, saying that that is not something you should be worried about, Niyamita. It's the trust, it's your communication, it's your problem, it's your vulnerabilities, it's your happiness. All these things matter, not the virginity.
at
Okay,
the end of the day, it's all here.
and yeah,
It's
It's
all
all
simple.
here.
good. Yeah.
Exactly, it is all here, you can say. Right.